55% of respondents, this includes nurses that work at hospitals, reported that they do not have a current residency program in place. Now, this presents a huge challenge, not just for the healthcare system, but for nursing care overall. When we're not able to equip our nurses with the skills and resources they need to achieve competency, patient care struggles. Not only that, our community struggle overall. Welcome back to Dr. Sellers Educate, everybody. We are happy that you're back as we continue to support you on your journey. Now, this statistic was very interesting. It's ironic that that was the title of the article because that automatically piques our interest. This was actually a report that was just published on November 21st, 2023 by Becker's Hospital Review. So let's go ahead and take a look at this report, dig a little bit deeper, and then we'll take a look at our content today. All right, so this is the report. It shared that 55% of respondents in a recent poll said their hospital does not currently have a strong residency program in place, despite nursing leaders citing such programs as a key retention tool, particularly among nurses, right? So we know that having a residency program in place is very effective. In fact, we're going to share today in our update within this snapshot, one specific healthcare system who has seen a dramatic increase in their retention. And what do they contribute it to? Well, at least one of the things is their nurse residency program. We're all on the same mission. We want to make sure our nursing students, and we here at Dr. Sellers Educate, our nurse educators are equipped with the skills, with the experiences, and with the support they need to ensure that they are bringing the very best evidence-based practices into the classroom to enrich the students' learning experience. In this specific snapshot, we're going to be focusing on what can we do to bridge that theory practice gap. Now, we know that there are a lot of challenges that we're not going to be able to get into today. However, there are some key ones that should be further exploring to make sure that our students are ready. Okay, so first we want to take a second to reflect with our thought-provoking question. In every snapshot, we like to focus on a thought-provoking question, but here is a key step in the process. We want you to just sit for a moment and reflect. Reflect on the evidence-based practices that you're already using in your classroom. Reflect on the impact that we are making every single day when we choose to show up in a way that's supportive of the student learning process. Okay, and as you read the questions, if you're on the journey for C&E, we want you to reflect on your firsthand experiences. And then we also want you to consider what you have been reviewing in your textbooks, okay? And just like every single snapshot that we have here on our YouTube channel, or if you're listening on the podcast, we want you to print out the study worksheet. This is going to make sure you write down the date, today's date, whatever day that is for you that you're watching this snapshot. And then second, we want you to write down your objective. Your time is so valuable, and we want to make sure that we're maximizing the time that you're spending with us. So write down, what is it that you want to accomplish? And then we want to hear from you. If you feel like there's additional content that you want to further explore with us, email us. We'll be happy to talk through resources that are available so that you can fully close your knowledge gaps. All right, so now let's look at our thought-provoking question. The complexity of patient care is a challenge for some nursing students to grasp. In the role of a nurse educator, what skill is crucial for conveying information to students? So we have A, properly completing a cardiac assessment, B, time management and prioritization skills, or C, communication and presentation skills. So think about two things. First, what is the question asking you? Okay, and then second of all, what is it that you know for sure related to the content that is listed in this question? Okay. Number one is going to be designing education programs. This role is going to include structuring, so developing our curriculum initially, and then we want to make plans to revise our curriculum. We know there can be lots of feedback that we receive related to our curriculum and the impact that it can have on our graduates upon graduation. So we want to gather that information from our colleagues to figure out what changes do we need to make. And then second, we want to make sure we have the right tools. as we think about the why behind our change in our curriculum, we want to make sure that we have, and sometimes we may feel like this, right? That we might have the tools, but how are they going to work together? And then the little shreds of wood, it looks like, I correlate that to sometimes tension and frustration that we can have whenever change is moving forward with something so important as our curriculum. Billings and Halstead Teaching and Nursing, Chapter 6, is a great resource to use. Remember that this content maps back to Competency 1, Competency 2, which is all around facilitation of learning and learner socialization. And even when you're thinking about the clinical role, consider how we map our clinical experiences back to our curriculum as well. We want to make sure there's collaboration and effective communication amongst all colleagues to ensure that we are mapping properly and that our students have a great learning experience. Another resource that I wanted to bring up that some of you may already have, it's a new textbook, and it is by Halstead and Billings, and it is titled Getting Started in Teaching for Nursing and the Health Professions. I think this is an excellent book, and I really like the work that they described in Chapter 4 related to common issues related to curriculum development. So some of them include in box 4.1, getting started includes being a productive member, okay? Being a productive member of the changes that need to happen. Even though we may not agree, we still want to collaborate with our colleagues to talk through the changes that are necessary. Again, going back to that evidence and making sure we're clear about what that is. Being our lab faculty, our classroom faculty, and our clinical faculty to make sure we have that comprehensive perspective from all three of our settings as we move forward with changes. And then thinking about issues that may influence, what our decisions are. We know that the complexity of care can be very overwhelming for so many of our colleagues at the bedside. So we want to consider the impact, knowing that 55%, now this was a small study when you go look at the data, 450 individuals, however, it's still data to consider. We're seeing more and more that residency programs are not effective, or if they have them, that there are some gaps. Okay, so just making sure when we think about our colleagues at the bedside that we are working collaboratively with them so that we can work together on solving the issues. And then as we wrap up, we just want to take another look at our thought-provoking question. So if you chose C, you are correct. Okay, so communication and presentation skills. Remember, this question was around conveying information to students. Do we want to make sure students are properly completing a cardiac assessment? Yes. However, it's not specifically related to the skill that we need as educators to convey crucial information. And then second, time management and prioritization skills. Yes, that's important. However, when we think about conveying information, it's all around communication and presentation skills. Remember that the purpose of this question truly is to create and stimulate thought. So we want you to go back to those primary resources, Chapter 6, and Billings and Halstead, Teaching and Nursing. And then if you've already picked up, I think it's a fairly new textbook by Halstead and Billings, and that's another resource you want to consider, especially if you are here because you want to make sure that you're strengthening your skills as a nurse educator. Now, if you're on the journey to C&E, we only want you to use Teaching and Nursing and Dr. Caputi's C&E review book, 2nd edition. Okay, so right now, we're still using the 6th edition for Billings and Halstead Teaching and Nursing and the 2nd edition for Dr. Caputi. All right, and then last is just to reinforce that we're here to support you until you are successful. We're always excited to hear from our nurse educator colleagues, and it's so ironic that the word that you will see in this testimonial that Susan used was she felt like that we specifically we supported her by providing her with the tools and materials she needed to help her close her knowledge gaps. Okay, so whether we're revising our curriculum, developing our curriculum for the first time, which by the way is so exciting to see so many new nursing programs getting started, that's great. We congratulate all of our nurse educator colleagues that are starting new programs or expanding their programs. But what we heard from Susan is exactly what we are seeking and what our mission is, and it is to support you all no matter where you are. So until next time, reach out if you have any questions. And for Dr. Sellers Educate, have a great one, everybody. Bye-bye.